welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Dr. Priyanka Ahuja, and today I'm going to talk about the links between migraine and adverse pregnancy outcomes. Self-reported migraine headaches were associated with 26% higher odds of adverse pregnancy outcomes, an effect driven by hypertensive disorders of pregnancy and both medically indicated and spontaneous preterm births. According to the latest research published in American Journal of Obstetrics and Gynecology, migraine affects 28% of women in their pregnancy-capable years and is associated with systemic inflammation, endothelial dysfunction, and increased risk of pregnancy-associated thromboembolic events. Adverse pregnancy outcomes may be defined as one or more of the following outcomes, that is, gestational hypertension, preeclampsia, eclampsia, preterm birth, that is both medically indicated or spontaneous, small for gestational age birth, or stillbirth. Migraine history has been associated with adverse pregnancy outcomes of placental origin, including hypertensive disorders of pregnancy and preterm birth. The authors Eliza C. Miller et al. Tested the hypothesis that self-reported migraine in nulliparous individuals is associated with higher odds of adverse pregnancy outcomes. The multi-center nulliparous pregnancy outcome study enrolled 10,038 nulliparous US participants with singleton gestation in early pregnancy, following them prospectively through delivery. Medical histories were collected from study participants by these standardized interviews. Participants were asked, "Have you ever had any of the following medical conditions or diagnosis?" followed by a list of diagnoses, which included migraine headaches. The researchers considered participants who responded yes to this question at the first trimester study visit to have a migraine history. They compared characteristics between participants who did and did not report migraines, including demographics, family history of preeclampsia, and comorbidities such as obesity, recent smoking, chronic hypertension, chronic kidney disease, pre-gestational diabetes, and autoimmune disorders. Of the 9,450 participants with complete data included in the analysis, 1,752, that is 19.1%, reported a diagnosis of migraine at the visit. Adjusting for all factors, participants with migraine had increased odds of any adverse pregnancy outcomes. For individuals with adverse pregnancy outcomes, the migraine had higher odds of any hypertensive disorders of pregnancy and both medically indicated and spontaneous preterm births, but not small for gestational age or stillbirth. There were no significant interactions between migraine and obesity, chronic hypertension, or diabetes. Sensitivity analysis showed a larger effect in participants who reported recent medication use. The authors concluded, in a diverse prospective cohort of 9,450 nulliparous US participants, self-reported migraine headaches were associated with 26% higher odds of adverse pregnancy outcomes, an effect driven by hypertensive disorders of pregnancy and both medically indicated and spontaneous preterm births. Migraine may be an under-recognized risk factors for adverse pregnancy outcomes. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.